Hey guys, welcome back. So this episode, how to survive a surgery prelim part 2. A few other tips. Number one thing, you need to pee. Okay, let me describe what I'm talking about. You're in the OR, there's a case, it's going on now 2 hours, 3 hours, 4 hours. And you need to go to the bathroom. And you think, well, I can't say anything. I have to wait until this case is over. Dude, you're not a med student anymore. Like, you're a resident, you're working, almost 80 hours a week. You got responsibility. You need to perform. You need to be rested. You need to make your needs known. So what do? I mean, are you allowed to pee? You think your full bladder and the pain of holding your pee in, for now like 3 hours, you think it's helping the patient? You think it's helping your attending? Patient doesn't feel your pain. Attending is focused on the surgery. Chief residents focused on the surgery. They don't know. They have no way of knowing this. Okay. So you can't now, after the surgery's over, oh, it's such a long case. Like they didn't give me a break. Like, no, you have to say something. Hey, doctor attending, I need to use the bathroom. Like, let me know when's a good time for me to scrub out and I'll come right back. You have to make your needs known. This goes for not just like when you're in the OR or when you need to pee. I mean, this could be, for me, for your first day of the rotation, sometimes you need to go to the badging office, the security office. I was at like my breast surgery, the badging office closed at like 3 p.m. I let my attending know. At the first case, right, the second case, like, hey, I need to go to the badging office, like, let me know when is a good time, when I can go. And she was like, oh yeah, like you can actually go right now. Like, I'm just about to do like this one thing, I'll need you, So make your needs known and don't think like, maybe there are some cases where you're super essential, but there's a lot of times where the scrub tech, your chief, someone else, a co-intern could, cover for you for a few minutes. So it's normal. This goes for doctor's appointments. This goes for your, your own needs, not just bathroom, but like maybe you need to make a phone call. Maybe it's interview season. You need to interview, or you need to call somebody, or you have a meeting with your program director or something, or a letter writer. So, I mean, I asked, and almost every time I was accommodated. The other thing is know the flow of the service. So there's a time for you to take breaks, and there's a time for you to be attentive. No one in the hospital is more annoyed than when they're ready to do some work and they're prepped and ready to operate or to round or to do a procedure or to visit a patient and do a wound care, dressing change or something. And at that moment, you're not paying attention to your phone. Like, let's say there's a wound vac change that's supposed to happen for this patient at like 2:30. Like, you should have eaten lunch at 1, or you should plan around these things. So you need to know the flow of your service. If your chief texts you like, I need someone to help me with this case that's starting in 10 minutes, and right then it's like, oh, I'm busy right now, because just right now it's like I haven't eaten all day and I want to go eat. Like, I mean, they might not yell at you, but they're going to be disappointed. So know the flow. And then another big one about knowing the flow is utilize downtime. There's a lot of downtime sometimes in the OR where you're basically right in front of a computer and you can do stuff. You can study. You can read up on something that you need to read up on that someone asked you about, or that you think is important to know to help your learning for the case. Or you might need to take care of some personal thing. Text your family member, call your parents, call your spouse, pay a bill on your phone. You got to utilize downtime. You can't be sitting there waiting for work to come and just wasting time, because you're in the hospital, you're in front of the computer. All of the things that you can do with a computer or with your phone, you should be doing them in your downtime. Okay, now when you're in the OR, you need to get to know the OR staff. This applies to med students too. You need to be polite, go into the OR, introduce yourself to the scrub tech, to the circulator, to the rep, if there's a rep. Pull your gloves, pull your gown, ask them, what can I do? What do I need to bring? Like, do you need an extra gown? Do you need an extra this? say like who you are. They always going to ask you to write your name or something, because first thing they want to do is document that you were there. Write your name, make it easier for them, leave your ID somewhere, and be friendly. Like, these people are your allies. They can only help you. I mean, they can hurt you too if you make enemies, but they really can help you. They can help you identify like when the attending, what the attending's needs are to help you shine more. They can tell you like what the attending likes in terms of Foley, positioning, antibiotics, whatever. They can tell you the approach that the attending usually takes. They can give you tips and tricks, because the scrub tech probably been in this OR for 5 years working with attending. I've talked to scrub techs. How long have you been working with Dr. So-and-so? Oh yeah, I've been working with him since he was a junior attending, and he's chair now, 15 years ago. And you think you're going to make an impression in one day, and they already know the attending, and the attending trusts them too. That's a big thing like that I've noticed. So here's another secret now. This also applies to med students. If you want to make a good impression, you really want to know like how this attending operates, read their previous op notes, okay? Not the brief op note, but the full op note. For example, some cases, like routine cases especially, gallbladder, appendectomies, read the attending's op note. That's going to tell you how they open, how fast they do it, what they do, how they like to dissect certain things, how they like to move things out of the way. And then it's going to tell you about critical structures. They're going to say, like, we protected this nerve, we protected this vessel. It's going to tell you about critical structures they could ask you about, or the muscle or the layers. They could say, this muscle was dissected bluntly or whatever. So you'll know if you don't know all the anatomy. This is like the cheat sheet of how to prepare for a case if you hadn't had time to study a lot. So it's going to tell you like how they like to close, how much layers, things like that. So then when it's your time to help out, to shine, to close, you can suggest and know exactly what they want. You can know if they want Dermabond, if they want Marcaine, if they want whatever. You can know these things in advance. So stand up for yourself. You're allowed to pee. Get to know the OR staff. Be friendly. Know the flow. Know when to take breaks. The other thing is you need to learn to recognize critical portions of the case. Okay? As an intern, I'm not going to interrupt as soon as my attending asks for a clip to stop a bleeding vessel. You got to read the room. Okay, you got to read the room. Non-critical portions, like, if they're closing, if they're doing blunt dissection in an area that is not of like great anatomical significance, maybe at the beginning of the case when they're just like chatting and stuff like that. But right when they start, getting into the thick of things, and there's bleeding and you don't know what's going on, and there's this and that, and you can tell they're struggling, their brow is bent up and they're focused. It's not the time for you to interrupt and say, oh, hey, doctor, like I really need to use the bathroom right now. So these are just, my tips, things that I've learned. Luckily, I haven't learned them the hard way, so hope it helps.